Friends, I'm Dr. Sai. Today I want to talk about sad state of doctors in the whole country. Uh, People might be thinking uh, after the completion of their MD or MS or DNB whatever, the doctor might be earning in lakhs. It's like a red carpet for them. They'll be leading very lavish life or whatever. So let me tell some facts. So when compared to 10-20 years back, becoming doctor has become relatively easier due to increased number of medical colleges and decreased competition. So you enter MBBS course, you read 4.5 years, you complete your final year part 2, then you enter your internship, you complete your internship, then the war starts, preparing for PG, and if you are working hard, if you are able to get in government medical college, it's well and good, and if you are not able to get, then you have to choose between a private medical college or DNB. You do your 3 years of PG, so you got your degree. Then again the war starts. So you'll be joining as a senior resident. If you have completed your PG in MCA recognized college, then you will be taken as SR directly. And if you have done DNB in private hospital or a corporate hospital or a charitable trust hospital, then the new rule came, new guidelines prepared by MCA recently in June 2017, stating that you have to again do 3 years of JR, and then you are eligible as SR. This is a new rule. This is a new joke. Because after completion of DNB, again asking the guy to do 3 years of JR to become an SR, it doesn't have any meaning according to me. If at all you are framing these kind of rules, you should have told at the time of admission. Okay, let us leave that issue. So now you are posted in as the government made the compulsory rural service, you are posted in some area hospital or a district hospital or some medical college. So only few people will be getting Gandhi, Usmania and Warangal, AMC, KMC, whatever GMC. Remaining others will be getting newly started government colleges and area hospitals. So the sad state is you will be posted in an area where there will be very limited facilities. You can't expect an ultrasound, CT, MRI. Forget CT and MRI, you can't expect even lab services and X-ray services even after 12 o'clock in the afternoon. And one more thing is getting paid every 4 months or 5 months, not every month. So how can a post PG guy can survive without getting 4 to 5 months salary? And biggest joke is the government is not taking any action on those RMPs who are doing surgeries or who doesn't have any license, uh, so and government wants to trouble the MBBS graduates. I mean, even if you have MBBS, even if you have 3 years MDMS, you are not eligible to practice. What is this nonsense? You still require 1 year of SR to practice. There is 1 year of compulsory rural service program. Is any other profession like lawyers, engineers, bank employees, or either any other profession, chartered accountants, doing this kind of bonded labor? No, they don't. Okay. And next comes the biggest joke. Making the super specialty guy post DM and MCH guys to work for 2 years. Otherwise, they have to pay 50 lakhs if they don't work. So that is the reason why there are 600 seats left in counseling. And so government doesn't give salary for 4 to 5 months. Okay. And you are not allowed to practice. Where every Tom, Dick and Harry practices in this country. He does some pati, he practices some pati. I don't know, I can't tell those things. So why are they not understanding the problem of the post PG guys? At least salaries they have to give regularly. I am not against any RMPs. I am not against them. They are doing very good service. They are serving in the rural people. At least show some consideration here. You can't give salaries every 4 to 5 months and ask them to do bonded labor. Which other profession is doing this? And salaries in central government, the assistant librarian gets 45,000. Assistant librarian. A degree guy is getting 45,000 rupees every month with a lot of facilities. And central government employees or state government employees, they'll have a lot of facilities, a lot of allowances and all. What about a post PG guy who has done his MD or MS or DNB? It's 10 years hard work, man. It's not a joke. It's 10 years hard work. It's not a joke. You have to clear around 17 subjects in MBBS. And there are people who fail in DNB twice, thrice, who read like anything, who have failed practicals thrice, written theory again, then they cleared the practicals. You are making a joke out of them without giving proper salaries and without providing proper infrastructure posting in rural areas. There are 3-star hotels in few areas where they doesn't have, the government hospital doesn't have ultrasound scan, they doesn't have a CT scan. See, how does the patient feel? He feels as if we are sending the patient. He doesn't know that they doesn't have ultrasound scan, they doesn't have a CT scan. So at last you will be ending in giving compromised treatment. So let this video reach as many politicians as possible and try to improve the infrastructure in all the government hospitals. Then it will be nice to work there. Otherwise, it will be a painful job. You can't. Without infrastructure, without facilities, how can you work here? How can you work? Can't. So I request the aspirants, the guys who want to take doctor as a profession, if treating patients is your passion, definitely you can. Otherwise, there is no fun in joining MBBS because it's not like the olden days. The competition is too much. Parents, just don't run behind your kids. Become a doctor, become a doctor. No. Don't do that because he will be the sufferer. So discuss with your colleagues, discuss with your seniors, and remember that at the end of after the completion of your super specialization and 2 years of bond, you will be finishing 35-36 years age. So parents, just don't run behind your kids that that uncle's son has become doctor, that relative's daughter has become doctor. Give choices to your kids. Let them decide what they want. And politicians, please try to improve the infrastructure in the rural areas, all the government hospitals, so that the doctors can serve better in the government hospitals. So, how many hospitals in Hyderabad, government hospitals in Hyderabad have NABH accreditation? Forget NABH accreditation. How many government hospitals have CT scans and MRI? Only 2 medical colleges, NIMS. Our city population is 1 crore. Improve the infrastructure. This video is not meant to hurt anyone, or this video is mainly to express the sad state of doctors. And there are so many things to tell. This is only tip of iceberg. Bye.